So it's now becoming clearer that this is not just a health issue or a gender studies issue, it's also an economic one. That menstrual health is tightly linked to gender inequality.
Welcome to VoxDevTalks. My name is Tim Phillips. Stigma, shame, and social norms around menstruation can prevent women and girls managing their periods with dignity and hygiene in low-income settings. So how can we provide information or influence those norms or change behaviour to improve women's health and well-being? Silvia Castro of LMU Munich and Kristina Czura of the University of Groningen have conducted extensive field research on these questions. They both join me now. Silvia, welcome to VoxDevTalks.
Hi, team. Hello.
And Kristina as well.
Hello, Tim. Nice to meet you.
Silvia, how many women lack the access to proper menstrual hygiene at the moment? What risks is this creating for them?
It's actually difficult to say exactly because the global data on this topic is surprisingly scarce. The World Bank estimates that around 500 million women worldwide lack access to adequate facilities for menstrual health management, but this is just the tip of the iceberg. In Bangladesh, for example, where we have conducted a lot of research, approximately 65% of adult women rely on cloth as main absorbent that is often repurposed from an old saree or similar materials. And despite this widespread availability in Bangladesh of period-specific products, such as disposable sanitary pads, nowadays we're still far from reaching full adoption of these products. Around 29% of adult women, according to the recent Bangladesh Bureau of Statistics, are now using pads. And this is just talking about products and products use, but in most low and middle income countries, even when products like pads are available, access to clean water, private sanitation might not be there. So the ability to manage menstruation with dignity is nowadays still constrained.
Thinking about the risks, they're also significant. So on the one hand, you have a lot of associations with reproductive and urinary tract infections of insufficient or unhygienic menstrual health care. And these can have serious long-term consequences, but these also often go beyond health. So in our research and also research that we have seen from others, it has been reported that inabilities to manage menstruation properly can disrupt girls' education. But evidence is not that clear-cut. Only recent evidence has really yielded very good and solid evidence that school dropouts is decreasing after the installation of pet vending machines in Kerala, for example. And if we look at women's participation in the labor market or absenteeism at the workplace, then the evidence is even more mixed. Yet we often hear that this is also a concern from employers, such as manufacturing firms in the garment sector that employ a large share of female workforce.
Recently, the mental effects of hygienic menstrual health management has also received more attention, in particularly when products are unsuitable. So globally, for the millions of women that rely on this repurposed cloth as menstrual absorbent, we have to think that these materials are not designed for menstruation, so they often have poor absorption capacity, they can leak easily, and they require careful cleaning and drying to remain hygienic. And for example, as a result, there are a lot of accidents, that they call it, in schools. So girls bleed through their clothes while in class, and this is quite common. So these incidents can cause shame, embarrassment, can lead to missed class time or even school dropout, so disrupting this girls' education. Later in life, when women enter the workforce, they continue to face challenges. Repurposed cloth might not be practical for long working hours, especially in environments with limited privacy or sanitation facilities. And while commercial products like disposable pads or menstrual underwear might be better suited to their needs, women often face additional barriers to accessing and using them, ranging from affordability, availability, social stigma, lack of workplace support. However, we do not yet have enough evidence on the role that each of these barriers impose.
We know very well that providing for women's health takes second place very often. Is menstrual health typical of that, an aspect of that, or are there additional barriers in this area?
Yeah, so we definitely think that it's part of a broader deprioritization of women's health, but it also comes with a unique layer of silence and stigma. So it's not just like neglected as with many other aspects, but it seems to be actively hidden. And so if you look at reports on like prehistoric culture and religion, then also menstruation plays a super important role there. And most of these narratives portray menstrual blood as something dangerous or unclean.
Mm-hmm.
Sometimes it's also positive that it has magical powers, but always it is something with a greater connection. It could be a gift from the gods or punishment for sins. These cultural perceptions also have real life consequences. For example, in some places, menstrual blood is perceived as something that must be released from the body. So the women clean their body by releasing this menstrual blood. And then also you have women who don't seek treatment for example, to heavy bleeding, which could be medically risky and it could be linked to anemia or iron deficiencies and so forth. And so when you also add low education and silence around menstruation to this complex cultural context, then many women lack accurate information and they also lack support. And then it's not just the lack of products that Silvia has portrayed, but it's also this deep-rooted discomfort to talk about menstruation. And that makes it much harder to address any issue related to menstruation through conventional public health messaging.
Has this traditionally been considered something for public health investigations and research rather than a topic for economists?
Traditionally, yes. Most of the work on menstrual health has come from public health and gender studies, and this was definitely the case.
Mm-hmm.
But economists now have started paying more attention, especially as we are starting to see barriers to menstrual health management might affect education, labor supply, or even long-term earnings potential. So it's now becoming clearer that this is not just a health issue or a gender studies issue, it's also an economic one. And so as economists, we're starting to see that menstrual health is tightly linked to gender inequality in both schooling and the workplace. So if a girl misses school every month or a woman avoids certain jobs because inadequate sanitation or fear of stigma, that's a constraint on human capital and productivity, and it's measurable.
And also in economics in general, there's an increasing interest in trying to explain culture, religion, and social norms. And there's also a growing body of literature documenting the influence of these concepts in a variety of domains, such as risk sharing or loan repayment, or you can think about political attitudes. And in particular for these cases where women seem to be negatively affected by harmful norms in very different domains, most importantly health and labor force participation, there's an increased focus on looking at also cultural aspects or social norms.
What can economists bring to the way that the research is done?
So on the one hand, we can apply many economic tools to rigorously measure impact, but also not just to seek to understand whether an information works, but also why. So economists try to disentangle different mechanisms, and that's what we have also tried to do. So we have tried to test whether an intervention actually has benefits or not, but then also trying to disentangle through which mechanisms. And another thing that economists can bring to the table is to really make these costs that go beyond health effects, such as lost hours of work or reduced school attendance, that have also long-term consequences that perpetuate poverty and inequality, to bring these costs on the table. And why we also think it's important that we can help shift the conversation so that it's not something that is just related to women's health, but that has broader implications on labor markets and inequality.
We're going to discuss 3 papers that you have been working on, all set in the context of Bangladesh, which we've already discussed a little bit. Now, in the first one, Cultural Taboos and Misinformation, it's a joint paper for the two of you. You're asking women in Bangladesh about menstrual hygiene. What are you trying to discover from them? And what sort of communities are you doing this research in?
On the one hand, we wanted to really document restrictions due to menstruation, misinformation about menstruation, and also menstrual health management. And we wanted to link it to the societal expectations about socially acceptable behavior and managing your menstruation. But then we also wanted to look at how these cultural aspects and social norms can affect the capacity to absorb information. Mm-hmm. So you have a lot of global efforts that try to improve menstrual health, and they usually focus on either providing information or products. And in particular, the information provision didn't show super promising effects. So what we wanted to ask is, when we look at information and the stigma together, can we explain why information is not absorbed that well? And we provide some convincing arguments, we hope, that describe the effects that we see to our intervention. Essentially, we have this information campaign and collect data directly before and after that information campaign. And so this timing, where there's little time space between the intervention and the first data collection, actually helps us to argue that everything that we observe can only be to the information provided. And then we also go back 2 years later and compare the data to the baseline that we have and to another study that was conducted by Silvia, Castro, the paper we talk about later. And they collected data at a similar time than our endline survey. We really see that their outcomes are much closer to our baseline, which also suggests that it's actually the information that we provided that drives the effects that we find.
The communities that we work with are artisan women in rural Bangladesh who are employed by Arong. This is a social enterprise part of the BRAC group. They're small, close-knit communities outside of Dhaka, and all of them work in embroidery centers within their villages. They work all together, and these centers is the locations that we're going to visit to do our study.
So at baseline, what are they telling you are their most common practices for managing menstruation?
We've already been mentioning a little bit, and the key part is that most women use repurposed cloth during their periods, and this number ranges from 40 to 70%, depending on the area of the country. Of course, the numbers are different in urban Dhaka to rural communities. Some also use disposable pads, but really cloth is the prevalent method for absorbing blood. And this reusable cloth is not per se a problem or the problem. What's important is how it's treated and how it's used, right? So only a small fraction of women actually clean and dry the cloth in a, let's say, hygienic way before using it again. It is recommended that it's washed with soap and then it's dried in the sun so that the UV light can kill the bacteria. However, many women wash it secretly. Sometimes they even use the latrines for privacy to wash these products. Sometimes they don't have enough clean water to wash them or soap. And then also, once the product is washed, even if it's well washed with soap, they hide it. They don't hang it out to dry. So sometimes they hide it directly in cupboards, under the mattress directly. So when they use it again, it's moist. And this can, of course, lead to a lot of bacteria in the product that they were going to use.
So are these constraints, these problems with the way that they are managing their periods, is this because of a lack of information, or do they have the information but they're worried about the restrictive social norms?
According to this study, it seems to be really both. So we do see large knowledge gaps about menstruation. So at baseline in this study is 27% of the women thought that menstruation is an illness, and 97%, so nearly all of them, hold a misconception that menstruation is a process of eliminating toxic blood from the body. Wow. So there is the kind of room for improvement in knowledge. But when we look at knowledge for menstrual practices, then the knowledge gaps are a lot smaller. So nearly all of them, equally 97%, are aware that you should wash reusable cloths with soap. But then when we look at drying, that seems to be a larger knowledge gap. Only 75% know that you have to dry it in the sunlight and it should not be stored with other clothes. But that leaves like 25% who don't know how to properly dry menstrual cloth. Then when we look at actual menstrual practices, then this knowledge is not really reflected in that, no? So as Silvia already said, most women prefer to wash their reusable cloth where they cannot be seen, and only 8 to 9% actually dry them outside. We also heard a bit in qualitative interviews or in conversations that, those practices would be seen as shameful. So if you see cloth drying outside, then it's being considered as socially inappropriate, and so forth. And we also do see that in the social norms that we elicit. We do see that our information actually can help to shift some of the perceptions for drying menstrual cloth. But then you also have that the menstrual blood is already out of the product. And for washing menstrual cloth, the stigma seems to be much stronger, because then you still have the menstrual blood that is stigmatized and considered toxic or impure still in the product.
So you were trying to evaluate how useful it is to provide information. What is the intervention here? What information are you providing?
We work with a local NGO to run 1 hour information awareness sessions for all the women. And these sessions cover the basics, what menstruation is, what's natural, what's the biological process behind it, and then also practical tips on how to manage it hygienically. The facilitators showed how to properly clean cloth, how to use pads, how to dispose of them, and even talk about common pain symptoms and how one can deal with them. The overall goal of these sessions is to give information, but also to normalize learning about menstruation and periods in the setting, not as something shameful, but as part of biology and health.
And you're delivering this in a group setting, not one-to-one.
Yeah, and we think that is part of what makes it like normalizing conversations about menstruation. If you would confine it to a one-to-one meeting, then it doesn't really make talking about menstruation, it doesn't normalize it also in a group of peers.
So what effects do you find from this? Do you find that the effects are persistent?
Some effects were immediate. They're surprisingly long-lasting. For example, after the sessions, the belief that drying cloth outside is inappropriate dropped dramatically. 2 years later, many women still report that it's socially appropriate to dry cloth in the sun, so outside. They also describe feeling less ashamed, and we observe an increase in self-reported hygienic practices. And as Kristina was mentioned, while the intervention helped improve these hygienic drying practices, we didn't find any shift when it comes to washing practices. So some norms, such as avoiding public wash facilities to clean menstrual cloth, like with the rest of the laundry, remain strong and unchanged. While information helps, it's not a silver bullet. Changing some norms might require more than just facts. They might need a deeper cultural change. The paper is descriptive. The results should be viewed as a foundation for future research. And we have other projects that build on these observations and analyze the causal impact through RCTs of this information, these awareness campaigns, and they show extremely similar effects.
You have 2 further papers, both set in the workplace in Bangladesh. What do we know about how menstruation affects women's work in Bangladesh?
So we started from some work that also looks at menstruation as a possible explanation for a differential labor force participation in high-income countries.
Right, yeah.
Also, there was some work that showed indications that women have more absent days than men, and also that menstruation leads to absenteeism, also presenteeism, so reduced productivity when at work. The premise was that in low-income countries, these effects could be probably amplified a lot due to the limited availability and also the use of hygienic menstrual health practices. We have looked at qualitative studies that have been conducted before, and many local organizations in Bangladesh had estimates that between 30 to 70% of absent days among female garment workers are due to poor menstrual health. And these numbers seemed massive. And also when we talked to garment factories, they were extremely interested in that because they said that absenteeism of their female workers is really disrupting their production lines. So if they can reduce that, they would be extremely happy. And they also thought that providing better menstrual health management possibilities actually helps. And the effects for working women could be fairly severe. No, they are mostly working in a setting where they don't get paid for missed days at work. The consequences for them must be fairly high if they miss days at work as well.
Yeah, of course. Now, Kristina, your paper is called Improved Menstrual Health in the Workplace. In this intervention, you provided information and menstrual pads to garment workers. What outcomes are you interested in?
We were, of course, interested in these kind of labor market outcomes, labor force participation at the intensive margin. So you can think about absenteeism and also productivity, which we proxy by earnings. We also wanted to go further and a bit unpack the causal chain of effects. So looking at menstrual practices, but then also health and well-being as potential channels through which this information provision or the sanitary pads actually affect these labor market outcomes down the line. We wanted to also look at disentangling information from financial constraints and also understand how they interact. So we didn't have just both treatments individually, but we also looked at how they interact. So to ask the question, is it really the affordability of products, or is information helping to adopt the technology? And then also, can this information maybe help to improve traditional practices and thereby labor outcomes?
Yes, how did you structure this to be able to separate all these things that you're trying to find out?
So we run this study in garment factories in Bangladesh. And in these garment factories, we essentially created 4 different groups to understand both these dimensions and also the interaction. So the first one is a provision of information. It's the same NGO that we have in our joint study. So they provide a 1-hour information campaign in groups of 20 women of the same factory. And then we have a second group where we distribute sanitary pads. And they get these pads, or they get a monthly ratio of sanitary pads that they can pick up in the medical rooms of the factory. And we provide this for 6 to 8 months. And then we have a third group that gets both, so the information and the pads. And then we have a fourth group that is the pure control group that doesn't get anything.
Mhm.
So you can think about information intervention and pads as 2 treatment dimensions, but then we have a full 2x2 design with 4 resulting treatment groups.
And is that successful in helping women to manage menstruation at work?
Yeah, so there we definitely see quite substantial effects. So if we look at the provision of free sanitary pads, then you have an increase of women who report to use sanitary pads by around 23%. And if we look at information, then that also increases knowledge on drying reusable products. So this is the main category where we see effects. And then also we see that workers who are in this information treatment are 95% more likely to actually dry reusable cloth properly. So we see quite large effects on like kind of menstrual health management. We don't find any crossover effects. So providing pads does not improve knowledge, or information doesn't improve pad uptake. And also, interestingly, we don't find any interaction effect. So information is not further improving technology adoption of pads once you receive pads. So it really seems that relaxing information constraints fosters also hygienic traditional menstrual practices by better drying, in particular the reusable cloth, and relaxing the financial constraints really helps to adopt the new technology of this hygienic new product, namely sanitary pads.
Now, those numbers represent quite a difference in behavior. Going back to our starting point, is this changing attendance at work, earnings, improving the women's well-being?
Partially. So we do find sizable effects on self-reported health. We ask for urinary tract infections, and there we see that both treatments actually reduce these urinary tract infections by around 0.14 standard deviations. So these are nice and not negligible effects. And again, we don't really find any interaction between information and pads, but it really seems that both using traditional practices more hygienically and using new products that are more hygienic per se has the same effects on self-reported health. But we don't find any other effects down the causal line. So we don't find other effects on self-reported well-being. And when we look at administrative data from the factory's HR records, we also don't find anything on absent days or earnings. So no reductions in absenteeism and no increase in earning or productivity.
That's surprising, isn't it?
Yeah, we discussed several reasons for why that could be the case, no? So on the one hand, we of course stress that these improvements in female health are important on its own.
On their own, yes.
Yes, exactly. But probably like a 0.14 standard deviation increase is not sufficient enough to reduce absenteeism, no? And this is a high pressure work environment where women don't get paid when they don't go to work.
Of course, yeah.
Women may already only miss those days that are absolutely necessary. And third, we have some more technical things that we discuss, such as power. And also we see an increase of pad use in the control group over time. So that also limits what we can find. But essentially, the 2 main takeaways that we see from that study is that providing information can also actually help use traditional menstrual material more hygienically. And it may be a cost-effective policy alternative to actually promoting different products. And we also do a follow-up study now where we apply network econometric techniques to actually measure the diffusion of our pad treatment along existing social connections. And we do find there is a substantial diffusion of these provided sanitary pads in our networks.
Yeah, very encouraging. Silvia, in your paper, Breaking the Silence, you're focusing on the stigma around purchasing disposable pads. Why is this stigma so strong?
Menstruation is still treated as something shameful and private in most countries in the world. And then with this shame attached to it, for example, buying pads means admitting, oftentimes in public, that you are on your period or you will be. Then now if we think of a setting like Bangladesh, where almost every corner shop or pharmacy is run by men.
Right.
So a woman has to discuss or mention a taboo topic with a male stranger while other customers might be around. So this mix of gender norms, maybe fear of gossip, and ingrained ideas that periods are impure can create a powerful social cost. So we were hypothesizing that this might be a barrier to the adoption, even when pads are available, they're known, and they're even not so expensive. And this is what we wanted to test in the study.
How did you try to change that belief that purchasing from men would be inappropriate or shameful?
So we organized 1 hour women-only discussion groups of around 15 to 20 participants or female workers at the time in their work. And what's a bit different from these projects of the previous information campaigns that we discussed is that here it was not about awareness or additional external information provision. 2 female facilitators simply ask women to swap personal stories, like when did you first learn about periods? How do you handle them at work? No lecture, no PowerPoints, just a safe space to talk. Hearing peers voice the same worries and maybe even laugh about them. Let women update their mental map of what other women really think, what other women go through. So in other words, we try to attack the silence directly, therefore the title of the paper.
Did these discussions change behavior?
Yeah, and quite quickly. We have 2 measures for that. First, the valuation, the general valuation of a product that they know, so disposable pads. We elicit their willingness to pay after this session to everybody, all the participants in the study, women in the control group and treatment group. And we saw that the women in the treatment group were willing to pay about 25% more for a pack of pads. And this is a product that is available, that they know well, but we see that actually discussions help them value the product more. A second measure that we have is actually the adoption. Are they taking up new period-specific products? So as Kristina mentioned, the factories are interested in making period-specific products available to women, so they swap from cloth. And so we offer them a brand new antibacterial menstrual underwear. So for this project, we collaborated with an NGO that was developing this new technology. It was for free. It was made available at the garment factory store, run by men, of course. And then either 14% more women in the treatment group go collect this product. So they choose to pick it up, even though they have to pick it somewhere where your colleagues might see you actually from a male shopkeeper.
Do you know what's driving this change in behavior? What's behind it?
The discussions didn't make pads cheaper, or magically better.
No.
So what changed was the social cost. And we try as much as possible in the paper to look at this in detail. So we observe, for example, a social norm shift. So before the chats, most women said buying pads from a man was socially inappropriate. Afterwards, the modal answer flips to it's socially appropriate. And we follow up even 6 months later after the study, and this change was there. In addition, we also have a choice experiment, discrete choice experiment in the study, and it shows that women that have been in these discussions care less about the shopkeeper's gender or the fact that they need to buy the products in a public space compared to the school. So it seems that the driver is a reduction on stigma and this shame of accessing the product.
So this is very encouraging research. And of course, the setting in Bangladesh is a particularly rich, particularly challenging one. But of course, this is not just a challenge in Bangladesh. Are you planning to continue your research in other settings as well?
Yes, absolutely. So we think there's still so much to learn about barriers that women face around the world when managing their menstruation. And we started to build up a global research agenda around it. So we are cooperating with Oxfam to look at a project in humanitarian settings in Central African Republic, Mali, and Somaliland. And there will be a draft paper soon also on preferences of women and how they value different menstrual products. We also have a current study ongoing in Nepal with school children where we have an information intervention that focuses precisely on these stigma components. And we are also launching a second project with our partner there. It's a German Nepali NGO called Nedisi, to also try to unpack a bit more these restrictive social norms around menstruation. And next year, we hope to go back to the garment factories in Bangladesh in the workplace to launch a project that focuses a bit more on workplace inclusivity, all related to menstrual health, but then revisiting this evidence and how it affects labor force participation. And that is in collaboration with a German NGO, Drip by Drip, who focuses also on water management in the garment sector. So we have a lot of projects ongoing in different settings. And you also see that we try to engage practitioners and policymakers as much as possible to really answer these questions.
Linked to this, the relevance of practitioners and how many people are now interested on this. Very recently, so 3-4 weeks ago, the Siemens Stiftung has indicated that they're interested in supporting financially research on the topic in East Africa, which is, we have not yet done research there. We launched a very small pilot. The details are still being finalized, but exciting things are definitely in the pipeline on the topic. So there will be research coming up. many new questions, projects, but they're all centered on understanding and breaking down barriers to menstrual health management and whether these are related to financial, informational, cultural aspects. There's still a lot to learn.
At the beginning, I asked the question, is this something that is a public health question or an economics question? But of course, there's no reason why it should be either or. Is there? Would research benefit from collaborative research in these areas where public health and economists, gender theorists work together?
Yeah, this is very true. This is a space where collaboration would be very helpful and is very helpful. Public health researchers bring deep expertise in biomedical and behavioral aspects of menstrual health, while economists add structuring by separating costs, benefits, and constraints to behavior. And this way we have to think about barriers. It also helps that both disciplines use rigorously, evaluate what works and why, and it clearly helps that both disciplines speak the same language method-wise. Our methods like randomized controlled trials and causal inference help identify the most effective, scalable interventions, but they are only meaningful if they're grounded in a deep understanding of health systems, stigma, and social context that normally public health experts have an advantage on.
You're doing a lot to change the way in which this is discussed, but it's clearly not discussed enough as yet. And I guess one of the problems is that half the world's population and far more than half the world's policymakers never have to deal with any of these problems day to day. How can we create a greater focus that would help to break down these taboos and these social norms?
Yeah, you nailed down the challenge. So the issue is invisible to many people, in particular those in power who are still predominantly male. But they also have real-life consequences on health, dignity, education, economic opportunity, mainly for women, but at the same time, also, everybody is affected if you think about disruption to production processes or suboptimal human capital allocation if girls drop out of school too early and so forth. We think that one way forward is really to create more evidence to show that a taboo like menstruation isn't just personal inconvenience, but it actually affects school attendance, labor productivity, and health system costs. And another way is to engage a bit more in storytelling. So this is why we also work with partners who are much better at giving voices to women experiences in a way that it's hard to ignore. And then if we can combine that with academic research and evidence base that we create from the data, then it becomes much harder to look away and to ignore these facts. And another thing that we think is extremely important is to bring men on board in these discussions as well. So a lot of the research at the moment focuses on the women and making them aware of knowledge gaps and stigma, but it's also important to sensitivize male peers and teachers and managers. And so in Nepal, we are just trying to do that. So we have the information campaign that we deliver to girls and then also to girls and boys and essentially compare what the effects are. And so, we think also in high-income countries, these constraints are still important. I mean, they're much more severe in low and middle-income countries, but also in high-income countries, you see that it's still not normalized to talk about menstruation. And there you have a lot of social media campaigns that help to create awareness and challenges that women face because of their menstrual cycle. And we hope that this will continue and create more awareness.
I hope so too, and good luck with your future work. Thank you for discussing it with me today. Thank you, Kristina.
Yes, you're welcome. It was a lot of fun. Thanks.
And thank you, Silvia.
Thank you so much, Tim.
So here are the papers we have been discussing. The first one is Silvia Castro and Kristina Czura. It is Cultural Taboos and Misinformation about Menstrual Health Management in Rural Bangladesh. That was published in World Development 188 in 2025. Then we have Kristina Czura, Andreas Menzel, and Martina Miotto, Improved Menstrual Health and the Workplace, an RCT with female Bangladeshi garment workers. That was published in the Journal of Development Economics 166 in 2024. And Silvia Castro, Clarissa Mang, Breaking the Silence, Group Discussions and the Adoption of Menstrual Health Technologies. That was published in the Journal of Development Economics as well, 169 in 2024. If you want to read about this on VoxDev, then the article Breaking the Silence, Advancing Health Technology Adoption Through Open Discourse on Menstruation. And that's Emily O. Young, Silvia Castro, and Yang Schlenk. That was published in September 2023. This has been a VoxDevTalk, the best way to make sure you don't miss an episode is to subscribe or follow us. Wherever you get your podcasts, you'll find us there. Our past episodes, as always, are at VoxDev.org. If you like what you're hearing, please tell someone else about us and leave us a review. VoxDevTalks is a Talk Normal production. The assistant producer is Megan Bieber and our editor is Andrei Zargarian. Thanks to Oliver Haney and Iman Siddiq at VoxDev.